This program is brought to you by Stanford Hospital and Clinics.
Well, thanks for coming today to the Stanford Lymphedema Center. It's wonderful to get a chance to talk to you. I know you are a breast cancer survivor, and I was hoping you could share with me a little bit about your personal experiences with breast cancer and with doctors and being treated and your current life.
Thank you, Dr. Roxton. Yes, I was diagnosed in 2004 and had a lumpectomy and sentinel node surgery, and then I had chemotherapy and radiation. And I have to say, nobody ever mentioned lymphedema possibilities to me. It may be because I wasn't a very good patient. I was pretty traumatized by the whole process, and maybe they just didn't want me to get more fearful. But I did join a support group, and that's where I learned about lymphedema, because there was another patient there who was suffering terribly with the sleeve, and it looked very uncomfortable. It was hot, and so that's how I kind of learned about it and then educated myself. And so I am careful. I do the gloves in the yard, and I'm very careful about mosquito bites. I'm almost sort of paranoid, I think, and definitely no one can take blood or do anything on the affected arm.
Good for you.
And so I thought I was kind of home and dry because it's been about 5 years now. But then about 6 months ago, I had this terrible pain in the breast that had the lumpectomy. Mm-hmm. And it became very red, and I guess I suddenly panicked and thought, oh goodness, I've got breast cancer again. It's the inflammatory kind, but then I got lots of chills and fever. It was a really frightening experience, and so luckily I could get to my oncologist the next day, and she diagnosed it as a delayed breast cellulitis, and I guess this was something to do with a lymphatic system.
I would say so.
So that was a wake-up call to have this, so far out.
Right.
So I wondered if you could maybe sort of, I'm nervous now, I guess, that it could come back at any time.
I understand that nervousness. I want to reassure you that the likelihood of a recurrent event like that is still pretty small, but of course vigilance and preventive strategies are the order of the day. Does the threat of lymphedema play a role in your day-to-day life? Do you think about it much?
Well, I am at the moment, just because I can still feel residual pain, and I can feel in my shoulder it feels a bit stiff, and I went for a follow-up check with my radiation oncologist, and I said, I'm still feeling this, and he said, well, because you had radiation, your tissue was compromised, so but again, tried to calm my fears.
Sure.
And I don't wear a compression sleeve, and so I'm thinking, should I be doing that at this stage?
Well, there are certain circumstances where it might help. It certainly might help relieve some of that sensation. It certainly might help to wear it in circumstances when the risk poses itself, like airline travel, for example, or during heavy exertion. Even during hot weather, which seems counterintuitive because it's the least comfortable, but that's when the increased blood flow to the skin might trigger some lymphatic problems.
Right.
Well, as we move to the future, what can we do for you as somebody who thinks about lymphedema prevention? How can we make this a better world for you?
Well, I do feel it is important that the patient is fully educated and without obviously scaring the patient. So I think we should be informed that there are risks, and so that we can be aware and then not delay treatment and just hope that it'll go away. And then also, as someone who's a survivor, I would like to know how I could help maybe people down the road. Are there clinical trials maybe that I could take part in, or that are available, so that we can learn more?
Yes, well, thank you so much for asking that. That's a wonderful question, because at least here at Stanford, we're very interested in moving the boundaries of knowledge outward. And I've been very dedicated over the last 10 years to finding treatments that are effective for lymphedema beyond physical measures. That is to say, drugs and other interventions, molecular therapies. And we've been working in animal models of the disease that I've helped to create, and we've made real strides. And we think we're getting to the point that some of this is ready to translate into patients. So we do have clinical trials here at Stanford. Anybody that's watching this clip who's within shouting distance of the Stanford campus should certainly get in touch with us to see if they might qualify for some of those trials that are going on now and others that will occur in the future.
That's great news. Thank you very much.
Thank you. Thanks so much for coming.